as tensions between the government and the medical community over increasing medical school enrollment remain unresolved. Major general hospitals are beginning to prepare for a prolonged shortage of doctors. They are actively planning for a scenario where not only residents but also medical students might not return next year. University hospital professors predict that the application rate for residents in the first half of next year will remain low, and medical students' collective leave of absence is expected to continue into next year, even if the government and the medical community reach an agreement before the end of this year. Many believe that hospitals must prepare for the medical system changes caused by staffing gaps and the recent conflict. According to the Ministry of Health and Welfare, 42 out of 47 major hospitals are participating in the government support project for restructuring these facilities, accounting for 89.3%. Maintaining hospital qualification requires meeting bed capacity standards, but with the loss of resident manpower, even keeping the current number of beds is a burden. The project focuses on transitioning to a system that primarily treats only severely ill patients, ensuring a stable medical system without residents. For this, hospitals need to build a specialist-centered structure. However, due to the high costs of hiring specialists, the number of general beds is expected to decrease 15% in Seoul, 10% in metropolitan areas, and 5% in regional hospitals. The reduction in general beds will inevitably change the revenue structure. Major hospitals will need to secure enough income from critical patient care. Consequently, investments in personnel and facilities for specialties with high numbers of critically ill patients are expected to increase. However, transforming hospital structures won't be easy. Adjusting the revenue model will likely lead to financial strain in the short term. A professor from one of the Big Five hospitals stated, revenue in major hospitals relies heavily on outpatient services. So transitioning to an inpatient-focused model will take time. The most pressing issue is securing medical staff. Hospitals are already facing resignations from professors due to overwork. If this trend continues, it is expected to worsen next year, leading to further shortages. Finding doctors to ease the workload has proven difficult. For example, Severance Hospital managed to recruit only 2 doctors to fill gaps left by residents. As hospitals focus on critical inpatient care, more hospitalists will be needed than ever before. A professor at Severance Hospital noted, even for the highly preferred Big Five hospitals in Seoul, it's hard to find doctors. It's virtually impossible for regional or even metropolitan hospitals outside Seoul. Hospitals hope government subsidies for the restructuring project will provide some relief. The government plans to allocate approximately 9 trillion Korean won, about $6.7 billion United States dollars over 3 years to secure personnel and resources for critical, emergency, and rare disease care. A professor managing operations at a major Seoul hospital commented, the project offers favorable conditions for adapting to the new system, such as additional points for critical care beds in performance evaluations. However, many are concerned that next year could be even tougher than this one. As significant changes in the healthcare environment loom, hospitals are prioritizing stability over innovation. Recent leadership reappointments at major hospitals like Seoul, Asan Hospital and Samsung Medical Center underscore the focus on stable management amid rapid shifts in the medical landscape.